words on medical evacuation. So with the increasing violence, particularly as the incursion in Gaza City intensifies, medical evacuation remains a flagship WHO program. Just last Monday, we actually medevaced 180 patients and companions. Gaza health system is unable to provide specialist care of services beyond the most basic emergency treatment. 15,600 people, including 3,800 children, need to be medevaced. Since October 23, WHO supported the medevac of 7,841 patients, including 5,405 children. With the conditions worsening, what we actually are requesting consistently, and I think we get a bit more traction on this request. First, that we need many more countries to accept patients. Second, equally important, maybe even more important, is the restoration of the West Bank and East Jerusalem medical referral pathway. Over to you.
I'll now turn the floor over for questions. Yes, please. Gabriel.
Hi, Mr. Peeperkorn. This is Gabriel Zondo from Al Jazeera English. Thank you for the briefing. Can you just, about the report, is this the first time that you've been able to gather this data about life-altering injuries, or is this something that's been going on in the last 2 years or so? Thank you.
Thank you very much. No, the first report from WHO, I think we published that last year, and that was with the assistance of emergency medical teams, and it was an assessment of this from January till May 24. This report is much more extensive. It's from January 24 up till September 25, but it also uses other data sources more extensively. There's, of course, always limitations in the data sources, but we definitely see this as an underestimation. And the most worrying thing is that in the report last year, which we also, I think, discussed with you, we had the same figure that one quarter of the injured were sustaining and would require long-term rehabilitation, lifelong rehabilitation. And we see the same trends from January up till September. So that says, but I think it says a lot about the conflict and how violent the conflict is, and the impact this conflict has. And we focused, of course, very much on everything related to trauma. I mentioned the amputations, the severe injuries to arms and legs, and the brain, spinal cord, etc. We didn't even actually, and we want to make an assessment of that too, but it is very complex. The mental health again impact, and the mental health impact overall. And that's maybe something to raise according to some of the estimations that probably currently, and that's probably over 1 million people are at least distressed by mental health in Gaza. Over to you.
Thank you. In the back.
Muna Abdul from Al-Quds Al-Arabi. Thank you very much, Doctor, for the briefing. My question is regarding Dr. Hussam Abu Safiya. 6 days ago, his lawyer was able to visit him, and he has reportedly lost significant weight. He's also suffering from untreated medical conditions. Could you please comment on what are some concrete actions your organization is taking to bring medical aid to detainees and also to vulnerable populations, malnourished children and pregnant women? Thank you very much.
WHO is, I can be very brief on that, is actually not providing medical aid to detainees. That's of course up to the in this say the Israeli government to take care of the detainees. We are of course very concerned about Dr. Hussam, and I know a bit. I know him quite a bit. I mean, I've been myself in Kamal Adwan Hospital. He was the director of Kamal Adwan Hospital, a non-functional hospital at the moment. I've been there many times, and specifically around November and December in 24. And then it was under siege in December. Maybe you remember that. And I think in January, February, he was detained. So we are extremely concerned, and I think WHO has spoken out multiple times, and that we expect that he will be released. But we are not providing any direct care. I wouldn't even know how to do that, etc. That is of course up to the government of Israel. And on the other vulnerable groups, I mean, like in Gaza, etc. Yeah, we try to, as WHO, we focus on 4 pillars of assistance. So the first pillar is essential health services, and essential health services includes essential medicines and medical supplies. But it also includes support to primary health care and referral care. It includes the support of emergency medical teams, and medevac. It's all part of essential health services. Then the other second pillar is very much public health intelligence and monitoring the whole surveillance aspect, health information system, more classical WHO work. The third pillar of support is coordination. So WHO leading and coordinating the One UN in health and partners as good as possible. And the fourth pillar, which we had hoped would be the biggest pillar in 2025, was early recovery and rehabilitation and reconstruction. And unfortunately, we've been able to do some rehabilitation of primary healthcare centers and some hospitals, small rehabilitations, extensions of hospitals, Nasser, for example, an extension of Nasser Medical Complex, etc. And we have ongoing plan to extend the field hospital for the Palestinian Red Crescent Society, so we can do larger medevacs and Shifa. But that's it. Over to you.
Thank you. Frank?
Thank you for doing this briefing. Frank Uciardo from TR2 World. 2 questions. First, can you break down the casualties and the deaths among women and children and men? How many women and children, and the deaths, how many were caused because of military actions by Israel, and how many died because of famine?
Thank you very much. No, I cannot break it down like that. We have, of course, the overall figures. Over 167,300 people injured, and roughly we talk now about close to 60,000 people killed. I think there has been earlier reports that among the deaths we talk about over 40% women and children. That has been, and on the injured, I just referred to that. So when you take this from this 167,300 people injured, you talk about 42,000 of them having life-changing injuries. Of them, 1/4, so that is 1/4 actually over the overall injured people in Gaza. And 1/4 of that are actually children. So then you talk about over 10,000 children with life-changing injuries. Over to you.
Thanks.
You've been there since like 2021 in your position in Gaza? You've been in Gaza since 2021?
No, I'm the WHO representative for the occupied Palestinian territory. So we have a team and an office in Jerusalem, in the West Bank. And now our larger team is currently in Gaza. So I'm based in Jerusalem, etc. And before the crisis, I was actually every month in Gaza. And since the crisis, actually from November, December 23, I've been every other month for 2 weeks, 3 weeks, or sometimes 4 weeks in Gaza.
What is your perspective like over the last 2 years? What has changed for you? What has gone through your heart and mind in the last 2 years of you witnessing this?
Well, before that, I was the WHO representative in Afghanistan for 7.5 years. And I've been working for more than 20, 30 years in Southern Eastern Africa. So I've gone through some as a young medical doctor and then before that as well. So I've gone through some grim scenes, like in Southern Eastern Africa. We went through as a young doctor, through the whole HIV/AIDS epidemic, which had a massive impact, of course, I saw also the refugees coming from Rwanda over Lake Tanganyika when I was in the north of Zambia, where we had to take care. In Afghanistan, many, I would say, grim scenes, especially in Helmand, Kandahar, and Uruzgan, etc. But what I've witnessed in Gaza, I've never witnessed before. How quickly the health system in Gaza, I mean, people always say, oh, the health system was actually very poor. No, it was not that poor. I don't say it was great. I mean, in some areas of non-communicable diseases, oncology, for example, they very much struggled. They needed to be referred. Before the crisis, between 50 to 100 patients were referred daily to East Jerusalem hospitals and the West Bank. But overall, the systems were working much better than you would actually imagine. The health indicators in Gaza and West Bank were actually better than a lot of the neighboring countries. And we've seen a health system disintegrating incredibly rapidly over. And I'm still actually surprised that with a partially or minimal working health system, how much is done. And that is a huge credit to the Gazan health workers and also organizations like myself and health partners, the EMTs, the emergency medical teams, which have been actually super operational. But of course, it's constantly on the brink of collapse. And maybe you recall that in this 2-year crisis, we have had many hospitals like Shifa, like Nasser Medical Complex, like Al-Ahli, like Kamal Adwan, etc., who all became non-functional. They were fully functional. Then in the south, in Rafah, we saw exactly the same. The moment a war is coming close to that area and forced evacuation takes place, even when it's announced like, oh, hospitals will be protected, etc., that's not how it works. Patients cannot leave or not attend. Health workers cannot leave or cannot actually come. We as WHO cannot bring in the supplies, etc. Electricity gets cut off very quickly. You see it from partially functional degraded to minimal functional and non-functional. And I've been part of the missions where we had to carry out the last 120 patients and 80 staff from Nasser Medical Complex in Al-Ahli and other places, Kamal Adwan, etc. What we now see, and I think is that we, every time, so it has been amazing that the hospitals like Shifa and Nasser Medical Complex, so when the military operations were over and people came back, that these hospitals within 6 to 8 weeks were again minimum to partly functional because of the health workers and the support of WHO and partners. Of course, what we see now happening in the north, and I'm very afraid that very quickly Shifa Medical Complex will be called non-functional and the other hospitals as well. And these hospitals should not, first of all, they should not be attacked. They should be protected, and the health workers as well. And we should make sure that they become again minimal, partly, and then fully functional. Over to you.
Islam.
Thank you, Doctor. Islam Dogru from Anadolu Agency. I would like to ask if you could shed a little bit light on how many WHO staff working currently at Gaza. Is it enough? And also you mentioned a little bit, but if you can elaborate on what kind of difficulties you go through every day with Israeli forces in terms of limitations and obstruction in Gaza. Thank you.
So I think we currently in Gaza, we have a team probably between 70 and 80. So that's from the international staff, they have so-called rest and recuperate. So every 4 to 5 weeks, they're out for a week or 10 days and they come back. So that's probably 15 and all the others are nationals. We recruited before the crisis. That's more interesting that we only had 26 staff and 1 international. So yeah, we quite expanded. I think probably even 80 now. We also expanded in Jerusalem and the West Bank to support these operations because we've done a lot of resource mobilization. But when I described that plan, yeah, we've been super operational actually from the start, straight away from October, November, where I remember that our office and our warehouse in Gaza City was, they were non-functional, destroyed, and there was heavy bombardments going on. So within a couple of weeks, we had new warehouses in Khan Yunis, and it's an interesting story. If you the Khan Yunis warehouses, they were, when I was there in January 24, got a call from the IDF that we better took out our supplies there because there would be military operations. Those warehouses got destroyed. Then we had 3 warehouses in Rafah. Then you had the Rafah incursion. Again, those were destroyed. Then we moved to Deir Bala, where we had 2, at one stage 3 warehouses. And you might have remember 21st of July, the largest warehouse got destroyed. We immediately rented another one, but it has been incredibly difficult to operate, not just for everyone, so not just for WHO, for UN and any partners. And we can provide you with an overview of the number of missions and the missions impeded and denied, etc. But it has been an ongoing struggle. We have, of course, had the blockade, etc. You've seen when there was a ceasefire, temporary ceasefire in February this year, how much actually could be done in such a short time by the UN, WHO, the UN, and partners. Over to you.
Abdul Hamid?
Thank you so much, Peeperkorn, for your briefing. We commend you for your courage and your straightforward briefing and honesty. I have a question. I mean, the Prime Minister of Israel said in the General Assembly, there is no famine in Gaza. So, as an eyewitness, how you can respond to that from your experience? And if you can share with us some of the little talks you have with mothers who are seeing their children dying of famine, and how do they cope with these tragedies? Thank you.
Yes, of course. The official answer I could give you, you have been briefed, I think, extensively about the IPC reports. And this, so I'm a simple medical doctor and a public health expert, but those are a whole group of experts on this areas. And we have had various IPC reports over the last year. And and I even remember very vividly in January, February 24, we also had for a while a blockade of the north. Maybe you recall that. And also we had a lot of, then the food supplies very quickly dwindled, prices went up very dramatically. And we saw, of course, also looting, from the few nutrition supplies which went up north. WHO was supporting that some therapeutic feeding centers in the north, for example, in Kamal one hospital, and patient-friendly hospital, and they visit them very often. And even then, you saw trends of very quickly increasing trends of children which were moderately malnourished, and a smaller group were severely acutely malnourished. So that was already, and we made the point then already in Gaza, before this crisis, there was no child malnutrition. You talked about 0.6, 0.5% for the children which were malnourished. So it was never an issue. I remember also health workers struggled to cope with that because they didn't know how to deal with that. We had to do this kind of specific training, etc., etc. Even then, I met so often desperate mothers and children, which, if you first would have a look, you would say they're 2 years, etc., and they were actually 4 or 5 years old, etc. Desperate mothers which didn't know how to manage and what to do. Now then, and this is the problem, and like the food supplies, everybody talked about food. What, of course, definitely everybody needs is diverse foods. A proper diverse food, and that has been the problem, I think, since this crisis. Way too little diverse food have come into Gaza. Now, over the last year, we saw again, and specifically again with the blockade, we saw very quickly rising malnutrition rates. It was, I think, in July, and let me say, it was suddenly what do we talk, 40,000 children which were assessed as malnourished. Yeah, and so I've seen also personally too many in all these what you call severe acute malnutrition centers, therapeutic feeding centers, etc. Too many children, which were clearly very much malnourished, and I ask sometimes talking to the families like when did it start and how did it start and what could you do and the lethargy. I mean, of course, it's always the most vulnerable groups. Often female-headed households, etc., the more vulnerable families where this also happens. What we saw also of late in the last year, we saw also a lot of pregnant and lactating women, which were malnourished. If you talk to the physicians and medical specialists in hospitals, and I've seen so many patients, I mean, severe trauma patients, I said, they even said even the simple trauma wounds, that their wounds and they didn't recover that quickly because almost all of them had a level of malnutrition, and so they say the whole recovery process actually was very much extended. Wound infections were, of course, also a huge problem. So, yeah, we have seen too much of this, and people ask me now as well, oh, but now there's a little bit more food. Is this now going better, etc.? Just want to remind everyone, first of all, yeah, there's a bit more food. That's definitely true. Prices are still way too high for many of the families. Food is still not diverse enough. But of course, if you have a number of specifically the vulnerable groups, and the vulnerable groups in IPC report were very much marked children under 5, but the IPC report also referred to older children and elderly. Now this is in a combination with horrific water and sanitary conditions, and all of is only exacerbating that whole process. So this will also take a long time, a really long time to restore. And I think some of the affections will be permanent. Over to you.
Ibtisam.
Thank you. Hi, my name is Ibtisam Azim, Al Arabi Al Jadid newspaper. I have first a follow-up question regarding Palestinian medical teams in Israeli prisons. If you could, I know you talked about Dr. Hussam Abu Safi, but do you have a number and how many actually, because some did die in Israeli prisons, if you have that number too. And my question is actually about medical evacuation. If you could I talked to some people who were medically evacuated from Gaza, and some of them said to me that they needed at least a year and a half sometimes to wait until, and sometimes they got the permission and they went to the checkpoint, etc., and then they were sent back. If you could walk us through what a person who needs a medical evacuation, what do they go through, and how long in general they have to wait, and what do you say to countries like the US who didn't take, rich countries who didn't take much people? I think the US took maybe about 80 people, and now they stopped any medical evacuation. Thank you.
Hold on 1 second. One second, please. We're trying to connect your audio again.
Sorry.
Oh, okay.
Sorry.
Okay, now we got you.
Yeah. So on your first question, I don't have much data. There's some Ministry of Health, it's not WHO statistics. I want to stress that. And that's some health staff violations. And their statistics actually raised the point that 1,722 health workers have been killed and 361 health workers detained. We cannot say anything about the detention procedures, etc. We do not have information about that. As you know, that WHO had one of his staff detained. We're very happy that he's released, etc. And we had struggled immensely. We didn't have any information, for example, about that staff member. Now, on the medevac, that's a good point. So I think it's what we would hope to see on the medevac, that we get a more comprehensive approach. So I think it's quite an achievement. The 7,841 patients actually have been medevaced, plus their companions and caregivers. However, there's still a need to medevac, an estimated need to medevac at least 15,600 patients, of which 3,800 children. What we would like to see is, first and foremost, we want a traditional referral pathway to East Jerusalem and the West Bank hospitals to be restored. Just as it used to be, between 50 to 100 patients were referred there per day. Now, if you ask me, could they take in 15,600 patients? Not straight away, but it would be a little game changer, and we would be really speeding up the medevac. They could definitely take up thousands, and we as WHO would have plans to support those hospitals, the East Jerusalem hospitals and the West Bank hospitals as well. The second point is, of course, more countries need to open up, and I really want to recommend that, and again thank specifically the countries in the region who currently, they were carried the burden. I mean, if you look at the numbers, Egypt, almost 4,000 Palestinian patients, United Arab Emirates, almost 1,500 patients, Qatar, almost 1,000 patients, Turkey, 441, Jordan, 268, recently Algeria, 136, Tunisia, 73, Oman, 56. Recently, we see a bit of a trend in the European countries. In total, that we talk about 350 patients. Mostly, I've seen it a lot with Italy, Romania, Spain, etc. UK started now. We would hope that they would also open up more and more high-income countries, specifically for the more complex cases, which maybe could not be or have more difficulty to be treated in the region. But again, we consistently lobbying with the Israeli authorities, but also with the member states, to reopen the corridor to East Jerusalem and the West Bank. And we really welcomed, we saw in the General Assembly, was a whole group of countries, European countries, I also believe Canada and Australia and the UK, who all actually are now pushing for this idea, etc., and also offer their support for that. Over to you.
Thanks. Deshi?
Hi, Dr. Peeperkorn, Xu Dezhi with China Central Television. Two questions. First is a detailed one. You mentioned about a couple of weeks ago there are about 600 patients still in Shifa Hospital, and then you said there's only like a couple of less than 40 patients there. So do you know where did those patients go after they have to evacuate from the Shifa Hospital? And secondly, you mentioned that you've been you travel to Gaza every 2 or 3 weeks or half a month since the start of this new round of conflict. Can you describe what is the change you see every single time when you visit all those hospitals, Nasser Hospital, Shifa Hospital, all those hospitals? What is the change? Thank you.
Okay. So yeah, at the moment, so this is what I just got this afternoon for some of the senior health staff from Shifa, which I met at Nasser Medical Complex, and so they raised with me that because I said, how is Shifa now? Is it still partly minimum functional? And they said we cannot even call it minimum functional anymore. There's a dialysis center which is still operational, and they said, well, there's a bit of an OPD for emergency, what we would call trauma stabilization point. And I said, how many inpatients? And they said there's probably only 40 inpatients left. So most health workers have left. Where did the patients go? Well, I think initially in North Gaza, some to Al-Ahli, it seems that around Al Ahli Hospital, there's still the biggest congregational population. So probably Al Ahli and other places. And move to the south. We have seen many more. I said something about the dialysis patients, for example, in Zueda. That's why also Nasser Medical Complex, they definitely got a load of patients, etc. And other areas. You see all of them. All hospitals now in the south are also completely overcrowded. What is the changes I've seen? By the way, I come to Gaza every second month. I said every second month, but that doesn't matter. The changes I've seen is there's constant changes. We have seen so many hospitals changing from partly functional and then becoming minimum functional and non-functional, and then becoming again minimum functional with all support and partly functional. We see, of course, currently a trend. We started with 36 hospitals, and now we're talking about 14 hospitals. So we see a constant decreasing trend. As you know that in Rafah, for example, there were 3 operating hospitals there. None of them are functional since a long time because Rafah is a wasteland. It's a militarized zone and there's nothing there anymore. The north of Gaza, where you had Kamal Adwan Hospital, Indonesian Hospital, you had Al-Alda Hospital, etc., all non-functional. It's a wasteland. So you have still a few health points and hospitals in Gaza City, and then you talk about the so-called middle area, Khan Yunis and Mawasi. Yeah, we have seen this constantly changing, and also the needs constantly changing. Every time the hostilities increase, the war actually increase, you see, of course, an enormous wave in trauma. And the biggest difference was, of course, this 2 months of ceasefire, where we saw people moving back to the north. We went all the way back to the north and looking for their destroyed or partly destroyed or completely destroyed houses. But still, I was really surprised at how quickly they went there with making makeshift tents, etc. In Gaza City, how quickly shops started to be restoring, private sector came back, etc. There was some kind of economic life. People went back to Rafah. I mean, like to the places we had plans to also start rehabilitating some of those hospitals, etc. And then again, ceasefire ended, etc. Hostility resumed, etc. And all these people were driven back to a very small area around Gaza City, and then in Khan Yunis, a small part of Khan Yunis and Mawasi, where we are currently. So we've constantly seen these changes. What surprised me most is still the resilience in the health system, because yes, I mean, we also say they are on the brink of collapse, but it's always surprising to see that it's still functional. And look at a hospital like Nasser Medical Complex. In January, February 24, WHO taking out the last 120 patients and 80 staff, non-functional hospital. And within 2 months, it was again minimal functional. And now again, it's a hospital which is addressing, I would say, almost all specializations in the partial level, with support also from fantastic emergency medical teams and NGOs. Over to you.
Thanks. Ibtisam again.
Hi, Ibtisam again. Just a quick follow-up. When you say minimal functional and partly functional, could you elaborate? And then also on visas for doctors from abroad, do you have any percentage? How many being denied now? Thank you.
No, we haven't. I don't have on the last question. I don't have the specific information. We've seen a trend in health workers and health workers that there was a higher denial rate of health workers for EMTs, but we're pushing for that, etc. There are still EMTs coming, but at the moment, for example, it's almost impossible. There's no EMT which will now actually work in Gaza City or the north. There's also very little to do. We discussed a little bit, should we still bring in some supplies? But we have to be very careful what kind of supplies we can bring in, because if there's very few medical specialists left and well, I'd say health workers actually operational, etc., that is a change. we've seen definitely issues with medical workers not getting or being denied, etc. But I cannot say it's always the same, that it always has been a trend. Your other question was on, I forgot now.
If you
Was
could
on,
clarify, you said minimal functional and
minimal.
partly functional.
Yeah.
What does that exactly mean?
Yeah.
Thank you.
Yeah. So minimum functional for us is when there at least is an outpatient department, when there is some inpatient department at least, there is some patient care available, and of course trauma services. So this is what we heard now from the senior staff from Shifa. They said you cannot even call it minimum anymore, because we cannot even call it a proper an emergency ward. It's more a trauma stabilization point, and very little in-service care. The partially functional is that some of the departments of the specialist department, they are there. If it is obs-gynae, surgery, etc., they are all there. But it's not what they used to be. I mean, like fully functional. They can only do a certain amount of specific interventions and operations because of the lack of supplies, but also some of their medical specialists not available, some of the capacity not available, etc. Over to you.
Okay. Are there any other questions? Oh yes, Islam. One more.
Thank you, Doctor. Last question. We mostly talk about injured Palestinians, Gazans, due to bombardment. What about you touched it a little bit, but what about the mental health, especially children? How do you concern about coming years, even decades, how they are going to deal with it? And are you doing anything currently about the mental issue in the Gaza?
Yeah, so we estimate that the number of people in Gaza requiring urgent mental health and psychosocial support has more than doubled. Like before the crisis, we talked about 485,000 people. 480, which was already huge for a population of 2.2 million. And that's, of course, also Gaza was a blockade. They went through a lot of escalations, etc. So we talk about that over 1 million people today, which will need some kind of support, more or less support. The services before this conflict, there were 6. Mental health was, I would say, there was one of the areas where I would say, which should be more developed. We always raised mental health and non-communicable diseases, especially, and maybe a little bit of an improvement in primary healthcare, which was needed. But still, before the conflict, there were 6 community-based mental health centers and 1 psychiatric hospital with a capacity of 30 beds. And all of those centers and the psychiatric hospital are not functioning anymore. With support, we also integrated mental health in 14 primary healthcare centers, and 4 mental health units were established in the MOH. So that's actually since the crisis. So you asked me what we do. Well, first of all, talk about essential medicines, medical supplies, including psychotropics. Make sure that they get into Gaza, which was not the easiest and took quite a bit of time. Then we tried to integrate mental health, which should always be the case, into primary healthcare. Support in 14 centers, and 4 mental health units were also established in the so-called general hospitals, including Nasser Medical Complex, Al-Aqsa, Indonesian, which is not functioning now anymore, and Shifa, which is also currently that part is not functioning. In addition, mental health services were provided by local NGOs. The Gaza, I think, Community Mental Health Program played a really important role before the crisis, and still, I think there, maybe you remember just last time the building, the primary healthcare center from the Palestinian Medical Relief Society and from the Gaza Community Mental Health Program was attacked and destroyed, Gaza City, just a week ago. And UNRWA did a lot as well. So in November 23, the only psychiatric hospital was bombarded and remained non-functionally. So currently, with the threat of new incursions in Gaza City, and other mental health providers have once again suspended services in the northern governorates. Now, I think we have to look at mental health. So we all, of course, want a ceasefire. We hope that somehow this plan kicks in, we get a ceasefire, and we get a road to peace. I raised today something about rehabilitation and trauma and injury rehabilitation, but we could also discuss for a long time about mental health, and mental health is part of that. And if there is finally a chance to start about early recovery and rehabilitation, that should be a really important component. And we have to do this in a different way, in a much more creative way. Not only do you have to talk about integration of mental health in every health level, so starting from primary healthcare and community level, but of course, we have to approach this in a different way at the community level, with local organizations and NGOs in a complete, I would say, different way. There's an absolutely a need. I think that probably no one in Gaza is not affected by what have happened and what is currently still happening. And this is, I remember that when we just had this Nasser medical complex starting again, we had also an UN official, and then I was showing around, etc., and discussed with the director. And she asked as well the same question. But what about mental health? And what are you doing about mental health? And then he also made the point, which I think was really correct. He said, first of all, we are all affected by mental health. But what we really need is, first, peace, ceasefire. We need shelter. We need regular foods, water, access to medical services, an education system which starts again, etc., in a private sector which again have a room to grow. And I think all those basics needs to be in place, but definitely on mental health, we need to address that in a massive, comprehensive, and hopefully in a very Palestinian, innovative way. Over to you.
Thank you very much. I'd like to thank Dr. Rick Peeperkorn, the World Health Organization representative in the occupied Palestinian territory, for his briefing. And thank you, Dr. Peeperkorn, and thank you and your colleagues for all that you do. Have a good day.
Thank you very much.
And for those of you who are staying here, I'll now read a few notes and take some questions. First off, the Secretary General strongly condemns today's deadly terrorist attack on a synagogue in Manchester, in the United Kingdom. Houses of worship are sacred places where people can go to find peace. Targeting a synagogue on Yom Kippur, the holiest day in the Jewish calendar, is particularly heinous. The Secretary General extends his deepest condolences to the victims and their families and wishes a swift recovery to the injured. He stands in solidarity with the Jewish community and calls for those responsible to be brought to justice. The Secretary General is deeply concerned by the alarming rise in anti-Semitism worldwide and stresses the urgent need to confront hatred and intolerance in all their forms. The Secretary General said in a social media post yesterday that he was deeply saddened to learn about the passing of Jane Goodall, who had served as a UN messenger of peace since 2002. The Secretary General said that she has left an extraordinary legacy for humanity and for our planet. He said he is grateful for her lifelong environmental protection efforts and her strong support for the United Nations. As a UN messenger of peace for over 2 decades, Dr. Goodall's voice brought global attention to the urgency of protecting our environment. Her legacy will continue to guide and inspire humanity's collective efforts for peace, sustainability, and harmony with nature. The Undersecretary General for Humanitarian Affairs and Emergency Relief Coordinator Tom Fletcher said today that as fighting continues in Gaza City, getting aid to the north is difficult. He stressed the need for humanitarians to be able to work unimpeded, noting that many have been forced to suspend their work in the area. Mr. Fletcher stressed that issuing displacement orders does not take away the party's obligations under international humanitarian law. Many civilians remain in Gaza City and must be protected. Meanwhile, the Office for the Coordination of Humanitarian Affairs says that people continue to be displaced from northern Gaza. In the span of just 10 hours yesterday, our colleagues tracked population movements counted 6,700 people fleeing from the north to the south. Since mid-August, more than 417,000 such displacements have been recorded. But conditions in the south remain unsafe. OCHA has received reports of intense strikes in recent days in parts of Deir el-Bala, one of the places where people have been told to move. Tents, houses, and even a crowded market have been hit, with the UN Human Rights Office reporting that many of those killed appear to be civilians. Between Saturday and Tuesday, some 127,000 people arrived in nearly 360 displacement sites that our partners have been able to monitor in Deir el-Bala and Khan Yunis. Altogether, those sites are hosting more than 500,000 people. Families in southern Gaza are squeezed into these and other overcrowded shelters or makeshift tents along the coast. Many others are sleeping out in the open, often amid rubble. New arrivals in the south face poor sanitation, no privacy or safety, and a high risk of children being separated from their families, all while being exposed to explosive ordnance. Our partners also warn of the financial burden of displacement, as families are selling their essential belongings to pay for transport. Those who can't afford it are forced to walk, which is especially hard for families with mobility challenges. To support people in the south, the UN and our partners have expanded services. For example, in Khan Yunis, the UN Relief and Works Agency has recently rehabilitated 9 medical points, alongside the Japanese Health Center and Hamad's Health Center, more than doubling the number of functioning health facilities there. Work also continues to rehabilitate shelters and other medical facilities. And of course, the UN and our humanitarian partners continue to operate in the north to the extent possible. Just today, Humanitarian successfully transferred some fuel to that area to power critical facilities that people rely on for their survival. From Ukraine, the Office for the Coordination of Humanitarian Affairs tells us that over the past 2 days, continued attacks across the country have struck large urban centers and damaged critical civilian infrastructure, disrupting the power supply as cold weather arrives. According to Ukrainian authorities, between September 30th and October 2nd, at least 90 civilian casualties were reported nationwide. Dnipro City, one of Ukraine's most populated cities, suffered a massive attack during the busy afternoon hours of the 30th of September. Several parts of the country, particularly the regions of Chernihiv, Kiev, and Sumy in the north and southeast, experienced power outages, reportedly impacting nearly 300,000 people. Furthermore, the Ministry of Energy reported a temporary disruption of its power supply, critical for maintaining the non-functional Chernobyl nuclear plant in the Kiev region. In the Odessa region, the impact of continued attacks was aggravated by heavy rains on the 30th of September, which resulted in widespread flooding, killing 10 people and causing widespread destruction, according to the authorities. Speaking on behalf of the humanitarian country team, Matthias Schmale, the humanitarian coordinator for Ukraine, expressed condolences to all those who have lost loved ones due to the floods and appreciation to the Ukrainian Red Cross Society for mounting a swift humanitarian response, working with local authorities. In the wake of the flooding and attacks, more than a dozen national and international NGOs, with the support of UN agencies, delivered emergency assistance to the affected people, including in the Odessa region. This included medical and psychological aid, emergency shelter materials, and legal support. In the wake of the flooding and attacks, more than a dozen national and international NGOs, with the support of UN agencies, delivered emergency assistance. I just said that. OSHA stresses that with the resumed attacks impacting Ukraine's critical energy infrastructure and worsening weather conditions, timely assistance is especially vital. The humanitarian community relies on sustainable support from donors to continue assisting the most vulnerable people in Ukraine. Turning to the Democratic Republic of the Congo, the Office for the Coordination of Humanitarian Affairs reported a continued uptick in violence in Ituri province in the east of the country. As of the end of August, local authorities estimate that the province hosts more than 1 million displaced people. Since mid-September, and as we have mentioned here, attacks by local armed groups in Jugu territory have specifically targeted civilians, including people living in displacement sites. Just this morning, local civil society groups reported that at least 10 displaced people living in the Roy displacement site in Jugu territory were killed by armed individuals while on their way to their fields. On September 27th and 28th, armed groups attacked a displacement site and at least 7 surrounding villages. These attacks resulted in 4 civilian deaths, multiple injuries, and the looting and burning of dozens of homes. More than 15,000 people were forced to flee to safer areas. Local sources report that these newly displaced people urgently need essential household items, shelter, and food. Our humanitarian partners are working hard to reach civilians affected by the violence, but they face acute access constraints, including the presence of numerous armed groups and funding shortfalls. Despite these challenges, yesterday our partners completed a round of cash transfers to nearly 6,000 vulnerable households, reaching more than 20,000 people. This marks the first cash-based food assistance for communities in the Mombasa territory of southern Ituri. We call on all armed groups to respect international humanitarian law, including by ensuring the protection of civilians in all conflict-affected areas. We have an update from our peacekeeping colleagues in the Central African Republic who continue to support the peace process in the country, including through their support to the National Disarmament, Demobilization, and Reintegration Program. In Sangere Lim, in the northwest of the country, the mission assisted the national authorities to disarm and demobilize 37 ex-combatants from the 3R armed group. In total, 154 members from this group were demobilized. Meanwhile, on the political front, the mission is also assisting preparations for the upcoming elections, which are scheduled for the 28th of December. The mission is facilitating the delivery of electoral lists and candidate forms from Bangui to the prefectures and supporting the operationalization of local branches of the electoral authorities. Our colleagues in the Central African Republic welcome the government's recent announcement of additional funding for the elections and remain fully committed to providing support in line with the peacekeeping mandate. Lastly, following recent clashes that we mentioned a few days ago near the Sudanese border, peacekeepers have reinforced their presence in the border town of Amdafok to protect over 11,000 displaced civilians. Blue Helmets intensified patrols and facilitated dialogue between local leaders and communities across the border to prevent further escalation and foster peaceful coexistence. The World Food Programme warned today that rising violence by gangs in Haiti's capital is restricting humanitarian access and pushing families deeper into hunger as extreme funding shortfalls force WFP to slash rations and suspend programs. WFP said that more farmers are cut off from markets, further straining already fragile food systems and pushing food prices even higher. Funding shortfalls have forced WFP to suspend hot meals for newly displaced families and to slash food rations in half. And for the first time, the lack of resources has prevented WFP from pre-positioning food stocks to respond to a natural disaster during the Atlantic hurricane season. Despite restricted access and extreme insecurity, WFP has reached more than 2 million people with assistance since January. Efforts to support longer-term food security and reduce dependence on aid are also continuing, as WFP works with the government to provide school meals for 600,000 Haitian students. Alongside this, WFP has also been able to launch targeted community infrastructure projects, including in areas controlled by gangs, to restore irrigation systems and boost local food production. As a reminder, Haiti is the only country in the Americas and only one of 5 countries globally with people facing catastrophic levels of hunger, which is equivalent to famine-like conditions. It is also one of the world's most severe food crises, with 5.7 million people facing acute food insecurity. WFP requires $139 million for the next 12 months to reach the country's most vulnerable families. And in Geneva this morning, the High Commissioner for Human Rights, Volker Turk, briefed the Human Rights Council on the situation in Haiti. The human rights situation in the country has reached a boiling point, he said, with more than 16,000 people killed and some 7,000 people injured in armed violence since January 2022, when monitoring by the Human Rights Office on gang-related violence began. Mr. Turk urged states to support the gang suppression force with sufficient funding and personnel. We can and must turn the situation around for the people of Haiti, he concluded. I want to flag a new analysis from the UN Development Program that highlights the precarious learning situation facing Myanmar's young people, who make up more than 1/3 of the country's population. Entitled A Generation on Hold, Youth Employment and Education in Myanmar, this is the second report in a UNDP Asia-Pacific series tracking the effects of prolonged conflict on young people in Myanmar. UNDP calls for immediate, locally driven actions to expand flexible learning and vocational training, especially for rural, displaced, and caregiving youth. The full report is available online. Today is the International Day of Nonviolence. On this day, we honor the life and legacy of Mahatma Gandhi and his unwavering commitment to peace, truth, and dignity for all. In his message, the Secretary General says currently we're witnessing a troubling erosion of our shared humanity. In these dangerous and divided times, he adds, let us find the strength to follow Gandhiji's lead. And tomorrow our guest will be Denise Brown, UN resident and humanitarian coordinator in Sudan, and she will be joining us from Tawala in North Darfur to brief on the humanitarian situation in Sudan. That's it for me. If we have any questions? Yes, Deji.
on the latest situation of the flotilla. Israel government now intercepts the vessels and escort them to Ashdod port. Do you consider this action again a violation of international law, given the fact it's being intercepted in the international waters?
Certainly, we believe that the laws applying to international waters must be respected. That's as much as I would have to say on that.
So what's the reaction from the Secretary General on those people who got detained?
We certainly hope that, again, our priority is avoiding any harm to come to those on board the vessels, and we hope that they will be treated fairly and with respect for their rights and their dignity. Ibtisam.
Follow up on that. Given the humanitarian nature of the flotilla, they were there to provide aid and break the siege. Do you believe that the Israelis should have let them reach the Gaza coast and upload their humanitarian aid?
We want all efforts to provide humanitarian aid to the people of Gaza to be supported. Obviously, we're aware of the security concerns that they had raised, but we want to make sure that all civilians are treated fairly and are not harmed. Yes, you also had a question?
Yes, thank you, Farhan. I noticed today there was not a statement on the ongoing protests in Morocco. On Wednesday, just yesterday, security forces reportedly opened fire on demonstrators in the small town of Leklia, which killed 3 people, and the country is now bracing for a 6th night of demonstrations. What is the SG's reaction, particularly to the use of live fire against the civilians, and has there been any attempt by the UN to contact senior political figures in Morocco? Thank you.
We're certainly aware of the violence that's happened in these demonstrations, and it's deplorable that, according to the reports, that at least 3 people have been killed. So from our side, we would urge transparent investigations and accountability for any people found responsible for violating the rights of people who are engaged in peaceful protest.
And apologies, sorry, just to follow up on the second part of that, of what I asked, was there any attempt by the UN to get in contact with any of those senior officials in Morocco, or not yet?
I believe our colleagues on the ground in Morocco are aware of the matter and are reaching out to their counterparts. Islam.
Thank you, Farhan. Israel threatened remaining population in Gaza City, asking them to move out and telling them that they would be considered militant supporting terrorism if they leave. What's the Secretary General position on this?
The Secretary General's position on this is that we believe that all civilians need to be kept safe wherever they are. And we've also made clear repeatedly that no place is safe in Gaza. So those who choose to stay in Gaza City must be kept safe there. Deji.
Let me get back to a flotilla. There's something, help me understand this. This fleet of vessels, they are carrying humanitarian aids. They're not carrying weapons. They went there, they're civilians, they are not soldiers. So why doesn't the UN support this flotilla to finish its work? Given the fact that you are actually, this very organization last year also mentioned about this, what they call the maritime humanitarian aid route, which has never been fulfilled.
We certainly encourage efforts to raise attention to the humanitarian problems in Gaza. We do this ourselves, and we support civilians who are trying to do the same. At the same time, what we're trying to do is find ways to avoid any escalation of the situation on the ground.
You think this is an escalation, the flotilla?
No, we don't think that the flotilla is an escalation, but we're aware of how this has worked out on the ground and in the waters. And what we're trying to do is make sure that that everything is resolved without, in particular, without any harm to those who are participating in this non-violent act. First, we're going to go to some questions on the screens, and then I'll go back to you. I believe there's a question from. I believe there's a question from Dennis from TAS.
No, before it was me. Anyway.
No. I've the list I have Dennis from TAS.
Hello, Farhan. Thank you so much. President Putin stated today that the UN structure must be reformed to reflect the reality of the global majority. Does the Secretary General agree with this assessment? And does he view this call as supportive of his own initiatives to reform the organization?
Sorry, could you repeat the question, please?
Yes. Does the Secretary General agree with this assessment? And does he view this call as supportive of his own initiatives to reform the organization?
Yeah, which assessment are you referring to?
Assessment made by the President Putin earlier today that the UN's structure must be reformed to reflect the reality of the global majority.
Certainly, the Secretary General also believes that there is a need to reform the structure of the UN. I can't comment on the specifics of this because I'm not aware of the specifics of what the Russian president was talking about. But yes, the general thrust of what he's saying is exactly in line with what the Secretary General is talking about. Stefano?
Thank you, Farhan. I'm sorry, I have to follow up on the flotilla. I don't think your answer was satisfactory because I repeated again the question. The question, I think also my colleague, is this. Can you clarify the UN position on the interception of the flotilla by Israel in international waters? Was this action legal under international law? And are the arrest of those on board considered lawful? So we asking if Israel could do this or not for international law. And you're just saying, you repeated the Secretary General wants that everything goes under international law. We want to know from you if the Secretary General considered this legal or not.
There are some disputes among different countries about what are the relevant parts of international law that apply to this situation. We believe that no harm should come to people in international waters, but we are aware of the different rationalizations that people have made. Obviously, it would be for courts to settle that.
But I'm sorry,
yes.
But we're asking what the Secretary General thinks. Not what other country dispute is. We know there are countries that think it's illegal, other countries think it's not legal. Because they don't transport weapons, because the fact is it would have been legal if they transported weapons, because they did not transport weapons. What we ask is simple. Does the Secretary General think that this was legal or not? Not what other countries think, what he thinks.
Our belief is that people who are simply carrying humanitarian aid should be left alone. We're aware of the different countries and the different fleets and different ships who have been involved in this. Obviously, at the center of it is the right of people to draw attention to humanitarian crisis, and we wanted them to be able to do that without harm. Yes. Yes, please. And then Abdul Hamid.
Yes, thank you, Farhan. I'm sorry, again, it's just another follow-up on the flotilla. You just mentioned how the reluctancy to comment on the matter as a violation of international law stems from the fact that the UN is waiting on a court ruling. Is that correct? Or not court ruling, but
there are many different international law on this in terms of the laws applying to the seas are complex. I don't want to oversimplify them.
understood. So there was a court ruling already, not on this matter specifically, but in 2024, the ICJ again ruled that Israel's occupation of Gaza was illegal under international law, which of course means that the sale of the flotilla through international waters is not in Israel's jurisdiction. So there is a ruling, which again is what you commented on. So doesn't that mean that, again, this is a violation of international law? The reluctancy I understand, but
Well,
again,
the Secretary General has repeatedly called on Israel to abide by the relevant International Court of Justice ruling, the one that you've mentioned, and he continues to do that. Abdul Hamid.
Thank you, Farhan. I always ask about a statement that shows me some kind of double standard on behalf of the spokesperson. A few days ago, you issued a strong statement condemning Ecuador for attacking demonstrators and killing one person. Now in Morocco, I raised the question to Mr. Dujarric. Today, the demonstration in Morocco is expanding, and there are 3 persons killed. Why there was no special statement? Not to tell me, our position. No, why there was no statement condemning the killing of civilians in Morocco?
You're in luck, Abdul Hamid. I have this just in, and I can read this out to you now. The Secretary General deplores the violence during recent demonstrations in Morocco, reportedly resulting in 3 people killed and several hundred injured. He underscores that protests must take place in a peaceful manner, respecting life, property, and the rule of law. He calls for a prompt and impartial investigation with a view to ensuring accountability. He welcomes the Moroccan government's stated intention to enter into dialogue and to listen to the voices of Moroccan youth. Islam.
Thank you. Can I continue? I have one more question.
Okay, one more, and then we'll go to Islam.
Yes, one more. I promise one more. Yeah. Yesterday, there was large number of settlers storming the Al-Aqsa Mosque in Jerusalem. However, I didn't see that in any of your briefing yesterday or today. What is your position on that, sir?
We believe that all of the holy sites in Jerusalem, including Al-Aqsa Mosque, must be respected, and that the status quo with the holy sites must be respected. So we stand against any violation of that. Islam?
Farhan, thank you again. This is not exactly comparison, but what comes to the mind, so I would like to bring that up. When there were attacks in Red Sea, in the international water, to the shipping, Secretary General was so quick to condemn, rightfully so, but now about the flotilla, he seems like hesitating, maybe to lose some impartiality. At least, did he contact any other leaders in terms of what happened to Sumut flotilla, in terms of how international law was breached?
Well, I don't have any contacts regarding the flotilla to share with you. Obviously, he's been in touch with world leaders, including during General Assembly Week, and has talked extensively about the situation in Gaza, including the sort of needs that were raised by the people on board the Sumud flotilla. Deji?
Again, the flotilla, since Stefano talking about international law, I have some further references. According to according to United Nations Convention on the Law of the Sea, Article 87 and 89, international waters are international waters. They're not sovereign to any countries, so they cannot be intercepted there. There's a freedom of navigation. And according to Geneva Convention and guidelines on maritime humanitarian assistance operation, you cannot intercept humanitarian vessels. So these are international laws. So clearly, if you're looking into the article, that's against international law.
Yes, we're aware of the law of the sea, and we believe that all countries need to abide by that. We're also aware of what Israel has said about its security corridor. Regarding that, again, for us, the priority has been to make sure that no one who is on these humanitarian vessels is put to any harm. And with that, I wish you all a good afternoon.